morning, everyone. I'm Christe Anastopoulos, the Executive Vice President of Sales with Spatz Medical, and I'm excited to kick off today's webinar with a collaborative session with Dr. Brooks and Dr. Charbel. Today's conversation focuses on an important topic, endobariatrics, as an emerging field in weight loss. This field offers non-surgical weight loss options with lower risks and faster patient recoveries. The importance of endobariatrics cannot be overstated, especially given the obesity we face here in the US. 42% of adults are obese. That's 141 million people, roughly every 2 in 5 adults, and the number is increasing. I'm excited to introduce two experts on today's conversation, Dr. Brooks and Dr. Charbel. Our first guest is going to be Dr. Jeffrey Brooks. Dr. Brooks is the founder of Spatz Medical, creator of the Spatz 3 adjustable balloon, and an esteemed gastroenterologist with over 20 years experience and an expert in non-surgical weight loss solutions. Jeff, we're happy to have you today.
Thank you, Christy.
Jeff is joined by Dr. Charbel. Dr. Halim Charbel is a board-certified gastroenterologist with over 22 years experience. He specializes in advanced endoscopy and endobariatric procedures. He is the founder of Digestive Care Specialists, a comprehensive GI practice, as well as the Silhouette Clinic, which focuses specifically on weight loss and offers the latest minimally invasive endobariatric procedures for the treatment of obesity. Dr. Charbel, we're honored for you to join us today.
Thank you.
On that note, welcome to Dr. Charbel and Dr. Brooks. Let's get started with today's conversation. So, Dr. Charbel, the first question I would like to direct towards you. What is the benefit of transitioning from a general gastroenterologist into an endobariatric specialist?
Sure. I went through that a few years ago, and I think there are a lot of benefits and interesting things that can be added to somebody's practice with endobariatrics. So people, of course, immediately think about the financial benefit, and certainly it is something in demand, and there is that aspect of thing that's important. People also think about the quality of life and the quality of the practice, transitioning potentially from a practice that's heavy on inpatient call, working late at nights, to something that is more scheduled, something that is more limited in time, so you have a better quality of life, and that is extremely, extremely important. But to me, there are also other benefits that it depends on where you are in your practice, in your life, what setting you practice in. So one, on the personal level, for somebody who is recently starting in the practice, it would make you more marketable. It may make you more in demand because patients want it. Obviously, based on the numbers that you mentioned, this is something that's going to be there and it's needed. Also, healthcare systems, hospitals, the more this becomes mainstream, the person as a physician becomes more in demand or more marketable. Otherwise, also in my practice, I think one huge deal, all physicians practicing deal with this. They can be frustrated with insurance companies, reimbursement, and restrictions. Also with referrals, if you are in a competitive area where there are healthcare systems that control primary care, control the referrals, you can, to some degree, break free of the control of the healthcare systems in a way for the referrals, and also more importantly from the insurance companies, where you're not dealing with long prior auth and low reimbursement. I think these are huge interest. Plus, it's rewarding, it's interesting. You get patients happy with the results, posting stuff about how you changed your life, giving you hugs. All that makes a big difference.
Absolutely. And I think you really brought up a hot topic there with reimbursements. Many doctors I speak to today, general gastroenterologists, are interested in endobariatrics and interested in transitioning into this business. Do you believe, as someone who's successfully transitioned into offering these treatments, it can be done in stages? And what would that look like?
Certainly. I mean, there are two different attitudes. Some people just transition completely from GI to endobariatrics 100%. I didn't do that. I transitioned and I kept my GI practice. I think there, again, it's a different attitude, but there are a lot of benefits. So you can be more conservative, more careful with your financial viability of the practice, with taking risks with a new service line versus a whole new practice. I think it certainly can be done with a GI practice. You already have some of the setup with the surgery centers, with endoscopy, with your staffing, where you can integrate endobariatrics. You can have a lot of patients who benefit from weight loss. We all do, but I think about fatty liver and other diseases that would certainly benefit from endobariatrics, so that you can integrate that. And you can think of it as a service line, and you grow it. And as it grows, you may want to scale back on your GI practice, or you may want to grow the GI practice by adding somebody else.
That's very informative. Thank you. And as I read about you and learn about your practices, many patients around the country come and travel to you for weight loss procedures. As it relates to endobariatric procedures, what would you recommend that you would incorporate into an endobariatric practice to be most successful?
So it's a different beast a little bit than GI. So you have to think about it differently. As I said, you're not relying on referrals just showing up on your door. You have to work on your marketing, how people perceive you, your online presence. So there's a lot of effort that goes before the patient gets there. From having a good website, an easy, simple website where people can understand what you're talking about and can very easily reach you.
So I just want to pipe in here a little bit. So Halim, you are offering obviously GLP-1 drugs, injectables. I think you mentioned to me at one point that some of your patients already come equipped with those medications from the family practitioners, or they're coming and asking you for it, and probably it's probably the first thing they ask for. That's natural. So you offer also balloons, and you offer the ESG. So I just wanted to make a note about that yes, for an endobariatric practice, you should be offering, the injectables, the medications. You should be offering a balloon. The ESG is a very nice extra component, which Dr. Charbel is an expert on that, and he does it. But it has a very steep learning curve. So for those who are interested in going into endobariatrics, you are not required to have an ESG as part of your arsenal. You can, but it takes a lot of procedures to learn it. I've spoken to many endoscopists who went through this, and a lot of them say 70 or 100 procedures under your belt before you really feel confident and that you're doing a very good job for your patients. So if you're willing to go through that steep learning curve, and there are courses, but the courses are not like a fellowship. The courses are, days or hours, weekends, and then having someone mentor you perhaps. But it's, it takes a lot to get to the level where Dr. Charbel is at right now. So it is not a requirement. I think that's an important thing to say, because a lot of people are very happy with a balloon, and a GLP.
Absolutely. Yeah. So, I mean, the way I think about it is that, I'm treating a disease, and I try to offer as many options to the patients. You don't have to offer all the options yourself, because eventually you have to collaborate with other physicians in your area, whether primary care is managing GLP-1s, whether bariatric surgeons, because we don't want to forget that some people still need surgery, still want surgery, or other endobariatric physicians performing something else. I do agree that the easiest and fastest way to get into the world of endobariatrics is the gastric balloon, because it's really a very simple endoscopy, and it doesn't require much learning, as you mentioned, and it's a pretty quick and straightforward procedure, and you can do it in the endoscopy room, so you don't need to have an OR and all that. So that's pretty straightforward and a very, very easy procedure to do.
Good.
Thank you for that. So what I'm hearing is there's potentially 2 points emerging that would create interest for somebody to transition from a general practice to an endobariatric practice. One of which is helping the patients succeed in their weight loss journey. The other is growing your practice both financially and combating those declining reimbursements we see. So when adopting the Spatz balloon, how has that impacted your patient outcomes in your endobariatric practice? And what has that done to your business from a financial perspective as well?
Yeah, so the Spatz balloon is different because it offers the adjustability feature, and I think that that is great because it makes me feel, you know, at ease with placing the balloon and more comfortable with the volumes I put in it because it gives me the flexibility, and also the patients love it. The patients love that concept. A lot of patients do not want something permanent. A lot of patients don't want anything more aggressive. So the balloon is a very easy idea for them to accept. And the fact that it is adjustable, they also feel that the flexibility would help them, so they go for it. So the first step in actually getting good results is getting the patient to go through the treatment. So that it makes it easier. Participating in the study with the Spatz balloon and then starting to place the Spatz balloon has been great because more patients want that service. More patients go through it. We had great results with the weight loss that is achieved with the Spatz balloon, and with being, you know, aggressive with the management of the balloon, with adjusting the balloon and such. We were able to achieve very good weight loss results, and Dr. Brooks can talk more about the weight loss results, but when we removed the balloon, we had superior weight loss results. And obviously, you want to maintain the weight loss long term, but that has been a game changer in my practice. A lot of people got interested and they started getting good results. And when somebody loses 15% of their weight and more, most people are really happy with that. And then we can discuss, you know, what do you do after that? Do you do combination therapy or something like that to maintain results long term?
I'll just make a point about the results of the Spatz balloon. I'm happy to see that in real life. They're seeing great results. But, you know, when you're offering therapies to your patients, you want to offer only the best. And if you're looking for a balloon, you have two choices in the United States. You have the Orbera balloon, you have the Spatz balloon. And in FDA clinical trials, the results are clear. They were not head-to-head studies, but they were almost identical studies. And the Spatz balloon had 15% weight loss, and the Orbera balloon had 10% weight loss. And the difference is about the adjustments. I won't go into the details about that, but that makes the difference. That's why we have such a better results. We also had an 84% success rate, as opposed to Orbera's 46.4% success rate. That means less than half the patients in the FDA trials had a good outcome with Orbera, and 84% of Spatz patients had a good outcome. So, and what's interesting is that the three options that we offer, the GLP-1s are about 15% weight loss. The Spatz balloon is 15%, and ESG is about 15, sometimes more percent. So offer the best. That's what you should be offering to your patients.
I just want to, repeat that same point that Dr. Brooks mentioned, that the GLP-1s provide 15% weight loss. So when you're going to talk to a patient, they're going to think about their options. I find it unlikely that the patients will go for an option that's going to give them weight loss less than the medications, because now this is the benchmark that we're working with. So you want to offer at least the same, because some people don't want to be on medications, but they don't want any treatment that gives them less weight result than the medication.
Yeah. And, you know, in speaking to physicians that use the Spatz balloon around the country and are using GLPs, they all say about the same thing. You know, the studies, not everyone has 15% weight loss. 50% of patients on these studies had excellent results, but 50% did not. 25% had mediocre and 25% failed, completely. So it's only half the patients that really do well. And even in that half that do well, once they stop it, they regain their weight within about a year or so. So if you're looking for a short-term use, drugs are great. If you're looking for lifelong changes, you need something more definitive, whether it's a balloon or ESG, and also supplemented, as I know that Dr. Charbel does, is he supplements his treatments with these GLPs when necessary.
That's a great point. And it leads me just to a follow-up question really quick, Dr. Brooks. You had mentioned the initial statistics of the balloon and weight loss. So thank you for that. But can you talk to me about what the weight loss looks a year or two after you remove the balloon?
Yeah, so there is a Spatz study that looked at patients 2 years after balloon removal and compared that with a study with Orbera. So in the Orbera study, 2 years after removal, 38% of patients still maintained a good weight loss, 10% weight loss at least. But in the Spatz patients, 76% of patients still had good weight loss 2 years afterwards. That's one study comparing, it was two separate studies, but we see the maintenance effect on patients 2 years after balloon removal, and Spatz has a much higher retention of weight.
Dr. Brooks, what training and certifications are necessary as a gastroenterologist to become proficient in endobariatric procedures, particularly all of them and Spatz balloon?
Okay, really, in a nutshell, to effectively treat patients with GLP, you just got to read a few articles, go to a few seminars, and you know how to use that medication, and then you learn with experience. That's easy. The Spatz balloon, for an average, or even say an average skilled endoscopist, not someone like Dr. Charbel who's above average, but an average skilled endoscopist can do a Spatz balloon. It's very, very simple. There's very little training. We can talk about that later if you'd like, but there's almost nothing. It's almost immediate. You're proficient in it. ESG, as I mentioned, is a different story. There's a steep learning curve. And, certification comes very easily with Spatz. Certification with the ESG requires more.
Excellent. Thank you for that. So anytime anyone makes a transition or a change, one can expect an obstacle or a challenge. Not everything is smooth sailing. I can only imagine transitioning from a general gastroenterologist to an endobariatric specialist that there might be some challenges that you face in that transition. Can you speak to some that you might want to highlight and how you overcame them, Dr. Charbel?
Sure. So there are different levels. Some of them are on the practical level, and some challenges are more about how the general approach is or how you think about the patient. Certainly, there are different patients. They approach this as more aesthetic sometimes. So you have to think about the way you approach the patients the same way a plastic surgeon or some dermatologist approach the patients. So the patients want service. As I mentioned before, they call several practices, they travel around the country, and they pick what they want. And based on what they see online, the reviews, and how you give them the impression of who you are, the initial impression, and how you treat them. So one, your image online is extremely important. Second, you need to provide excellent service and fast service. So a patient reaches out, you want to reach back to them very fast. You want to give them a lot of information. You want to be very transparent. Like when somebody wants to know what the cost of the procedure is and what it includes, they don't have to go through hoops to know that. You should be very transparent about that. Other than that, you need to dedicate time. Like the consult for a patient looking for weight loss procedures is longer than somebody who's there for acid reflux. Patients may have a lot more questions. Like nobody comes for evaluation of reflux and ask you how many EGDs have you done before and stuff like that. So you need to dedicate time. If you have a GI practice that's busy and you're on call, dedicating time may be a challenge. So sometimes you may want to dedicate blocks in your schedule where this is where I schedule endobariatric consults versus everything else, or on days I'm not on call and such. And then the patients do want personalized treatment. I give my patients my cell phone number after I do the procedure. If they have something, I tell them, if you worry about something, if there's something that concerns you, call me or shoot me a text message. And sometimes it's very, very simple, easy stuff, but the patient is scared of something, and just a quick reassurance over text message takes care of it. So these are things that are very important, mainly dedicating the time, I think.
Mm-hmm. Do you have any tips and pearls as to how you would market as a general gastroenterologist transitioning into bariatric, how you would market the Spatz balloon or related endobariatric procedures? What strategies have been most effective for you to reach those patients?
Sure. So, I mean, if you talk to anybody who's an expert on marketing, they will tell you that you have to use all platforms. They complement each other. You cannot just rely on one. So on the local level, you also want to make sure that the primary care physicians, other physicians who you don't think about generally in GI as referring physicians, are also important. GYN, fertility specialists, orthopedic surgeons, Sometimes somebody needs a knee replacement and they just need to lose 30 pounds before they can get the surgery. So a balloon would be ideal for that. I've done a bunch of these. And so on the local level, being listed on all the local listings, of course, but also on a higher or more general level for marketing, as I mentioned before. So social media is extremely important, all channels of social media. And if somebody's handling marketing for you, they can publish things on all channels of social media, connect them. That's pretty easy. Google ads are very, very important and probably like the most cost-effective, best return is Google ads and the image online. So taking time, having good patient satisfaction impacts this a lot because you can market as much as you want. People can see you. They're going to go and look at your reviews online. They're going to go and look at your website, and then going to see how transparent you are, how easy it is to get information from you. And also, they're going to look at your reviews. So that's something to take care of. It only takes one bad review for you to lose patients. So taking the time and providing the service, whether the patient ends up getting the procedure or not, the last thing you want is somebody upset and giving you a bad review online, because then that will impact you negatively, very seriously.
When it comes to learning a new procedure, how would you handle complications or adverse events related to the Spatz balloon when integrating that?
So the good thing is that the procedure is very safe. The balloon is very safe. The risk of complications is very low. I haven't had any serious complication or anything like that. We did have, obviously, patients having adverse effects from the balloon, for sure. Everybody goes through that, and particularly initially after you place the balloon, they're going to have a rough time with nausea, with having enough oral intake and such. So as I said, having access, whether you give them your cell phone or whether you have the setup in your practice where it's very easy to reach the on-call physician if they have any issue, that's one extremely important thing. Second, what I did in my practice is I thought that I definitely want to avoid that the patient ends up in the ER to get IV fluids, or because they're getting, they need some IV antiemetics and such. So I set up IV fluids in my office. So if a patient needs IV fluids, they get IV fluids in the office. If they need IV antiemetics, I give it in the office. And that's been really a game changer. Like, if I put a balloon on Thursday and on Friday the patient is doing so, I'm not in control of what's going to happen over the weekend, I'll give them a liter or two of fluids. The medications, so having a protocol for what medications you're going to use. From the simplest thing, you want to give the patient, let's say, a Prepitent or something, or sometimes promethazine suppository. You need to know where it's available, like in a pharmacy near you, or like I know near the surgery center, because sometimes you prescribe the medicine and people don't get it, and they show up and they don't have it. So you want to have a backup plan. Instead of having the patient not take the medicine, end up with adverse events, I talk to the local pharmacist, make sure you keep this for me because I'm going to send you prescriptions, and we do stuff like that. Using other medications, such as I use Zyprexa sometimes for managing severe nausea and vomiting after the balloon, and making sure you address the right problem. Many times the problems are more than just the nausea. The problem is anxiety. If somebody is having anxiety, you need to recognize that and manage that, because otherwise you can give them as much antiemetics as you want. That's not gonna treat the situation. So if patients end up with a balloon removal, I would say most of the time it's not because of severe medical intolerance to the balloon, but somebody having major anxiety and they just say, I don't want it. So giving them anxiolytics is also very helpful.
As it relates to support and resources, this is a topic that kind of emerged just from when you were speaking that I wanted to ask about. Dr. Jeff, what do you have for physicians who want to adopt the Spatz 3 into their practice to best support them to be successful?
Yeah, sure. So, we have a lot of experience. We have well over 160,000 balloons implanted in 50 countries around the world. We've trained, personally, I've trained hundreds of doctors, and our trainers have trained more hundreds of doctors. So we've sort of honed it down now. We know how to train our doctors. We know what's necessary. We provide them with the information prior to starting balloons. We give them clinical handbooks on this. We have wonderful animations that really describe the procedure and sort of troubleshooting to make life very, very easy for doctors. So again, those with just average skill endoscopists can easily learn how to do the procedures. So I think it's all there. We also have, training teams that will work with your staff, with your dietitians, or with your staff in the office if they don't have experience with balloons. So it's all there and it's available. It's really easy. And I would say that it doesn't take much time to learn how to manage a balloon patient and have your staff learn how to manage a balloon patient.
And if I may add, the availability of the training videos that you guys made is extremely important. Dr. Brooks, I mentioned to you before, before I started putting the balloons, I made every person on the team, my tech, my nurse, they all watched how to place the balloon, so everybody knows exactly every step, because obviously you want to make sure it's a team effort. So these were very, very helpful as well.
Good. Glad to hear that.
Thank you. So we've shared tremendous knowledge today on endobariatrics and some statistics around what's happening in the industry, as well as solutions for minimally invasive procedures. And most of all, tips and pearls to transition from general gastroenterology into endobariatrics. So let's continue to work together to advance the field of endobariatrics and make a positive impact. Thank you both for your time today.
Thank you, Halim.